Hello everyone, this is designing and validating a questionnaire. This is a session that I did in the last classroom session, but I'm aware that some of you weren't able to attend, so I'm just doing a little talk over the slides so that you can not miss out on the pearls of wisdom that were imparted on the people that were in class last time. So the reason I'm doing this as well is that it has particular links to your assignment, your end of module assignment. So it might be useful for you to listen to this, and it might inform what you're doing in your end of module assignment. So this is a table from an article that I've sent one or two people who've been inquiring about the process of validating a questionnaire, but it can be also applied to any other types of assessment as well. So it is a 2017 article, and it is guidelines for developing, translating and validating a questionnaire in perioperative and pain management, and it's from Saudi, and the link at the bottom will take you straight to that article. So the process that the paper is outlining, obviously the paper is hugely detailed, and you will not be able to do that in the word limit that you've been given for the end of module assessment. But this table in particular, I think, gives you an idea of the process that you should be thinking about when you are looking at designing your assessment. So this is applied to a questionnaire, but you could look at this in terms of how you are constructing the assessment for the end of module assignment. So if you are thinking about developing a questionnaire or using a questionnaire, the first preliminary considerations that you should be thinking about are identifying a construct of interest, i.e. that is a content area, a paradigm, an area that you want to assess. So you're identifying this area that you want to assess, or construct of interest, and if you're thinking about developing a questionnaire, so for example an evaluation questionnaire or other type of questionnaire, you would look first to see whether there's a validated questionnaire already available. If there is a validated questionnaire already available, then what you may do is to look at how applicable that validated questionnaire is to your construct. So is it near enough to your construct to actually be the assessment for or the questionnaire that you're going to use? If the answer to that question is no, then you need to be developing your own questionnaire. And in the case of the article, there was a questionnaire available, but it was in a different language, so they needed to translate it. So essentially, in this table, we're concentrating on the left-hand side of the table. So you've decided, after preliminary consideration, to develop your questionnaire or your assessment. And the process is then to establish an expert committee. So in the class last week, we were looking at developing an evaluation for the module, and the class members were the expert committee. In your case, in terms of the assessment that you're going to be looking at, your expert committee will be the people who've developed and are teaching on the module, or the unit of study that you're looking at. So you establish your expert committee. You look for expertise outside that group if you don't have it, but you should have the expertise within the module group, the unit of study group. And then what you do is, number 2, is identifying the dimensionality of the construct. Now, dimensionality is kind of an interesting word to use, but if you were looking at it in assessment terms, you'd be thinking about, another word for dimensionality would be the scope of the construct, or the scope of the assessment. So what is it that you are looking to measure, and how? And if it was in a module situation, you'd be looking first of all to the learning outcomes to see what needs to be tested, and then developing dimensions out of that, or the scope of the assessment out of those learning outcomes. So the dimensionality really means the scope of that questionnaire, or the scope of the assessment, or the scope of the idea that you're hoping to test. And then you looking at determining your questionnaire format, or your assessment format. So what type of assessment is it going to be? If it's a questionnaire, how many questions are you going to be having? What form will those questions take? Will it be multiple choice? Will it be a presentation? Will it be will it be a text box with a free range of answers, etc., etc.? So what's the assessment format going to be? Then determining the items in that format. So, how many questions are you going to have within that assessment? How are you going to, what word count are you going to have? What weighting is that assessment going to have? And then you actually develop the items. And in the case of a questionnaire, it would be the actual questions that you're developing. And that, obviously, you need to be considering the way in which you are developing those items. And we'll come on to that in a few minutes. You determine how long the assessment is going to be, how detailed the assessment is going to be, or the questionnaire. And then you obviously design those, so you write them. And then you review and revise the initial items, creating, if you like, a pool of items, and then choosing. So if you overdevelop, you can then choose the best ones that will meet your final assessment requirements. In the case of a module or a unit of study, you could use an external examiner to then be your reviewer for that assessment, and ask them to provide some opinion on whether they think that the assessment is a useful one, and that would be extremely good practice to do. And then you would, if you had the scope to do this, and certainly for a questionnaire you would do a preliminary pilot test of that assignment or that questionnaire, and you would be looking then to the results of that pilot to see whether or not that was reliable and valid, using the testings that we've been thinking about in this module. So reliability in this particular case for this particular questionnaire that they've used internal consistency, they've used retest reliability and inter-rater reliability, and for validity they've used content, construct, and other validations that they're not detailing here. So looking at reliability and validity, testing that pilot results for validity and reliability, and then looking to adjust according to the results of the pilot, and then that is a validated questionnaire. Okay, so one of the key things that you'll be looking at when you're developing your end of module assessment is to classify the educational learning outcomes into levels of complexity and specificity. So remember what we looked at Bloom's taxonomy. Bloom's is one of a range of different ways in which you can do that. For example, in higher education, there's the SEEK level descriptors, the QAA, benchmarks, etc., etc. Bloom's is one of the best known, I suppose, taxonomies of learning, and what it allows us to do is to identify at what level we are seeking to assess the learning outcomes for this for the teaching that we're doing. So knowledge and remembering is at the bottom, going up to the top to evaluation and creativity. Remember though that sometimes if you are assessing, for example, master's student, there may be some understanding and explaining to be done in the assessments, and also if you're assessing undergraduate students, so levels 4, 5 and 6, there may well be some analysis and evaluation going on in their assignments too. So what I'm trying to say here is that there's sometimes an overlap of these levels of complexity and specificity. However, generally, we're looking at making sure that the level that we're setting the assessment correlates to the level at which the students are being taught. What should be tested? So one of the things that we're looking at is what is the context of testing. So in terms of the assessment, not only are you looking at what the content of the module is, you're looking at also at the purpose of the training. So if you're looking at a program's overall outcomes, what are we trying to achieve here? What are we producing at the end of our program? The context of testing is really quite important, and the limitations of that context also need to be considered. So in terms of how we can test, the context is very, very important. What's available to us, what resources is available to us, are real kind of limitations, if you like, or they are advantages to us in terms of the context of testing. The second one is what we are testing and why. So remember to be looking at, are we looking for knowledge recall? Are we looking for an application of this knowledge to a practice context? Are we looking for a skill? Are we looking for application of that skill? Are we looking for empathy, attitudes, values, etc., etc.? So what are we going to test, and why are we testing it? And that will lead us back to the outcomes for the programme. What is it we're trying to achieve here? Who are we producing, and for what purpose? And then what the impact of the testing is. So impact relates to the results. So in terms of what we're trying to achieve, the impact of the testing is really, really important. Are we going to get a set of results that will that will give us what we want? Are we going to have a massive impact on the student that will have a negative impact on them? Are we trying? Are we testing to see if there is knowledge recall here and they've learnt what they're supposed to have learnt, or are we testing to promote learning? And if we're testing to promote learning, we should be looking really at the less reliable and valid assessments, but the ones that are promoting the most learning. So, for example, we could be looking at doing a group assessment. We could be looking at a discussion or a wiki page, or lots and lots of different things that might promote constructivist learning principles in terms of promoting learning. So are we looking at, is this a high stakes exam where we're absolutely looking to produce a result that says you can practice in a profession, or are we looking to promote learning to bring people further into the characteristics that we're seeking? So utility of assessment, or usefulness. So utility just means usefulness of an assessment, and that's been defined as the product of its reliability, its validity, its cost effectiveness, its acceptability and accessibility. That should say, I've said acceptability twice, but it should be accessibility. And all of those things need to be considered in terms of utility, without one being hierarchical over another, unless it's purposefully done. So, and in cases where, as I've said in the earlier slide, reliability and reproducibility is paramount, educational impact needs to be sacrificed, and vice versa. you can sacrifice some reliability and reproducibility, knowing that you're doing that, knowing the limitations of that for educational impact. And that needs to be explained to the people that are taking part in the assessment as well. So assessment literacy is really quite important here, so that people who are taking part in that assessment understand what the purpose of that assessment is, and why they're being asked to undertake it, in the circumstances in which they're being asked to undertake it. Validity, we've gone through this in the module. Is it measuring what it's supposed to measure? Remember the bridge of death, and how consistent an assessment needs to be. We're looking at content and construct and criterion validity, and subgroups of these, for example, face validity. But don't get too caught up in these different definitions, because you'll find in the literature that they're described in different ways. Construct validity is really considered to be the umbrella term for different types of validity, under which content, criterion, face validity all sit. So construct validity is the umbrella, the whole construct of validity is the umbrella term. Content, criterion, face validity, all of those subgroups are subgroups of that wider construct validity. And then reliability, and you know there are different types of reliability. Remember Matt's dots in the circle and outside the circle, test and retest, internal consistency reliability, parallel forms, split half, inter-rater reliability. And you'll find in the literature that there are other types of reliability that are mentioned as well. So people kind of take liberties with the way that they're describing reliability. This is just to illustrate that. This is from the same study that I talked about earlier, and the link to that study is in an earlier slide. But these are the ways that they are talking about validity and reliability. So they have diagnostic validity, they have known group validity, they have concurrent validity, they've got predictive validity, etc., etc. So that's just to demonstrate that there are a variety of different ways in which validity can be talked about, and frequently are. However, despite all of that detail, the main principles of validity and reliability remain constant. And then this is just a slide from the same article that has some tips on writing questions that I think that just make some very interesting points that are related, I suppose, to reliability and validity, but also have some common sense messages too. So tips on writing questions in questionnaires: use short and simple sentences. Ask for only one piece of information at a time. For example, have you had nausea and vomiting in the last 24 hours? Someone may have had nausea but not vomiting, so that question should be divided into two questions. Avoiding negatives if possible, because you're leading them. In the last 24 hours, how many times did you not have pruritus? A better format would be, in the last 24 hours, how many times did you have pruritus? Asking precise, and that will translate into evaluations in terms of, if you ask a negative question, you'll get a negative answer. Some of the ways in which you could word an evaluation could be, for example, name 3 things that you have found valuable on this module or on this area of study, and name 2 or 3 things that could be improved on, or name things that could be improved on. So you're kind of leading people down a positive way, or not leading them down a negative way. Asking precise questions, example, have you had pain before? The better question would be, was your pain worse in the last 24 hours? Ensure that those you ask have the necessary knowledge. For example, have you had neuropathic pain before? Many patients don't know what neuropathic means. A better question would be to ask about the symptoms of neuropathic pain. Have you had episodes of piercing pain, like hot needles in your skin, before? Avoiding unnecessary details, as people are less inclined to complete long questionnaires. How to make sure that you ask for all of these essential details. However, make sure that you ask for all of the essential details. So try and not make it too detailed, but make sure the essential elements are there. Avoid asking direct questions on sensitive issues. For example, are you obese? Can be best written as do you think you have a weight issue? Or what your feelings about your weight. Try and minimise bias. So I was satisfied with the pain management I had, yes or no. Better to ask about the level of satisfaction on a scale of 0 to 10. Many patients may choose to say yes to please you. Avoid weasel words such as commonly, usually, some, hardly, or ever. Hardly ever. For example, do you commonly have pain? Is better written, how often do you have pain? Avoid using statements instead of questions. Avoid using agreement response anchors. In the Likert scale, that's quite common. Your post-operative pain was the main concern. Well, it might not have been. A better question would be, what was your main concern before surgery? Avoid using too few or too many response anchors. Use 5 or more response anchors to achieve a stable participant response. We saw that in the section on Likert scales in the module. Verbally label each response option. Use only verbal labels and maintain equal spacing between response options, and use additional space to visually separate non-substantive response options from the substantive options. So make sure that it is absolutely clearly set out. Arrange the questions and always go from general to particular, easy to difficult, and factual to abstract. And the last one that they're talking about here is consider adding some contradictory questions to detect the responder's consistency, as some tend to tick agree or disagree in a kind of or go right down the middle in an attempt to kind of standardise what they're saying. So some of these things will be relevant to your assessment, some of them won't. I'm very, very happy with everybody's engagement on this module. You've been absolutely fantastic. We hope we've been flexible enough for you to be able to undertake the module and also deal with what life is also throwing you at the same time. Good luck with the assessment. I wish you well over Christmas. Hopefully you'll have a good time, even though you've got an assessment to do. You are allowed time off, so please allow yourself time off to do it. We've put the assessment date back until the 11th of January because we've had some appeals to our better natures from some of you. So I hope that makes a difference to you, and good luck with your next module.